Nowadays, many people are trying to answer the question, what is prediabetes? Some of them may feel at risk, such as people with a family history of diabetes. Other people may be struggling with diabetes and are concerned about their family members. The more you know about prediabetes, the more you are prepared to deal with it, should it develop in the future. Studies concerned with what prediabetes is consider a variety of factors. Normally, prediabetes is a medical condition that develops prior to type 2 diabetes and, in most studies, show a connection between the two diseases. Approximately 79 million people in the U.S. have been diagnosed with prediabetes. Any information related to what prediabetes is may be useful to some people, as it makes them aware of the symptoms. At the same time, this information presents people with ways to deal with prediabetes wisely. There is a general answer to the question, what is prediabetes? When the blood glucose levels of a person are higher than normal, they are at risk of prediabetes. However, tests are needed to determine if someone has prediabetes. An individual with blood glucose levels between 100 milligrams and 125 milligrams per deciliter is prediabetic, while an individual with glucose levels of 126 milligrams per deciliter or above is diabetic. There are tests for prediabetes diagnosis, such as the fasting plasma glucose test, or FPG. The test focuses on the glucose levels in the blood, and individuals are not allowed to eat before having this test administered. Another test is called the oral glucose tolerance test, or the OGTT test. Prediabetics have a 50% increased risk for heart attack and stroke. Therefore, it is important to find out whether you have this medical condition. A part of asking what is prediabetes means finding out what treatment options are available. For some people, it'll be a matter of dealing with the disease or using treatment to avoid type 2 diabetes. For others, it will be to lose weight. Studies show that a loss of 5 to 10% of body weight is helpful, and diet and exercise are usually recommended. Walking 30 minutes per day for 5 days is a fitness option, along with many others. Answering the question, what is prediabetes, can be done by using many information sources available. So, if you are concerned about prediabetes due to your family health history, or because you may have noticed symptoms, getting an answer to the question, what is prediabetes, and how you can deal with this condition is a good first step. For some of you, this information may help you prevent this condition altogether.